Go to Nigeria now, where about 60 people have been placed under close watch over the outbreak of the contagious Lassa fever in Rivers State. 12 medical personnel that attended to the victims have also been placed under observation. Now, according to a statement by the Lagos Ministry of Health, Lassa fever is contracted by ingesting food or drinks contaminated by the saliva or urine of infected rats, or even by catching and preparing infected rats as food. Now, official figures at Friday put the number of deaths resulting from Lassa fever at 40, with the number of reported cases sitting at 85, and that's just within the last 6 weeks. Lagos is Nigeria's biggest city, so authorities are no doubt concerned and therefore urging residents to be vigilant. Well, let's bring you the latest on that outbreak of Lassa fever. We're joined now live from Lagos by CCTV's Deji Badmus. Deji, first of all, what can you tell us about these cases? We understand there's been 86 reported so far, but what more can you tell us about these particular cases of Lassa fever in Lagos?
Well, Lindy, first, there's been no reported case of Lassa fever in Lagos. Of course, 10 states have been affected by this current outbreak. Lagos is not one of them, but there's a neighboring state not very far away from here that is also part of the states affected. Well, what we do know is that the Lagos state government says it is doing everything possible to ensure that we do not have any outbreak in the state at all. Even though there's been no reported case, the state government has been carrying out extensive and widespread enlightenment campaign, educating people on how to avoid coming in contact with the virus, telling people to maintain basic hygiene. But as you've been reporting in Rivers State, it's been very bad there. But the state government in that state has said the situation has been brought under control because it has been able to trace all those who came in contact with infected persons in that state. Lindy?
Well, as you say, the state reassuring people that they are doing all that they can. But West Africa has suffered greatly with outbreaks of diseases such of this nature. Just how concerned are citizens there at this stage?
Well, people are obviously concerned, very worried, especially when you consider the fact that Ebola struck here not quite long ago, and people are really surprised that we're having this. And one of the reasons why people are actually surprised is because, we've always had Lassa fever. It's been here, and I've been speaking with some virologists here in Lagos, and what they've been explaining is that, look, Lassa fever has been around for a long time, and that what happens is that you always have it around this period, the dry season period, when you have bush burning, so the rats will leave their normal habitat and then probably gravitate towards living areas, so that it's normal to have it at this time. But the problem is that we never had it at this scale, where the mortality rate authorities are putting at 40%. The highest we've ever had was 22% mortality rate, but this is very high. Authorities are confounded. They are still investigating to find out why the mortality rate is this high and why it is spreading very fast. But people are obviously concerned, and they are taking the enlightenment campaign very seriously. Lindy? Well,
of course, Lagos did do especially well during the Ebola outbreak. Just how confident are authorities now that they can basically contain the Lassa outbreak?
Well, authorities in Lagos here have been sounding very confident that, look, they do not, even though they do not anticipate any case at all in Lagos, but that they are very much prepared in case there was any outbreak. The State Commissioner for Health, for instance, has been on TV, has been on radio as well, telling people not to panic, and that, look, this disease is quite different. The virus is quite different from the Ebola virus, even though they have similar symptoms. That in the case of Lassa fever, the state government has the antiviral drug to deal with the disease, and so that people should not panic. That what people just need to do is, if anyone came under some kind of severe headache or fever that is refusing to go, that they should just report themselves immediately, and that people should also try as much as possible to maintain a basic hygiene and cover their food with rat protector and ensure that they do not create any environment at all that would allow rats to come around. But it is pretty confident that it would be able to deal with any outbreak that could occur in this state, especially when you consider the fact that it says it has an antiviral drug to deal with it.
Oh, that is good news indeed. Deji Badmos live for us there in Lagos, Nigeria.